I'm answering all the questions. One of the doctor with the clinical exam said that he wants to take the clinical exam this year when the exam dates open, but his biggest problem was there was long gap, 2 years from part 2 study. Okay, this doctor unfortunately failed the exam, which is sad, but it's not a big deal. All it is you need to find out what your mistakes are. If you don't know what your mistakes are, most likely you will fail again. Okay, so these are the common mistakes I've seen. So the common mistakes I've seen are people don't have structure, they can't manage time, they struggle with time management, they miss diagnosis, then they are not focused, excessive fear. When I did thousands of role plays, I've been an examiner for mock exams for the RAC GP and Adelaide to Outback GP training and Northern Health Network. So when I was doing workshops and role plays, and when I see these are the common mistakes doctors do. So my advice is, if you believe that if you have any of these problems, you need to work on it. Structure is the very important thing. Time management is very important thing. Not taking focused history, like asking irrelevant questions, and not understanding the Australian healthcare system. So if you don't know the guidelines, you will probably, like, I can't treat like what I do in India, or I can't treat a patient like what I do in Iran, or even UK. The guidelines are different. You need to know that, when to refer, when not to refer. And a lot of doctors don't have confidence. That is the biggest thing I've seen, is you will get confidence when you master all these things. So that is one thing I would advise this doctor who said that 2 years after part 2 study, yes, it's a fear thing, but you have no choice. You have to go and appear in the exam and smash the exam. Okay, you don't have a choice. So what I would advise is, find out what your mistakes are and work on them. If it's a structure problem, you need to develop your own blueprints. Okay, so these are very, very important. If it's a time management problem, you need to develop your own blueprints. If you're missing a diagnosis, then you need to work on your knowledge gaps and guidelines. Then you need to be clear. You need to have a mentor. Stop learning from someone who is not even working in the healthcare system. So these are the things I believe are the common things. So go and work on them and pass your exam this time. Like I tell all the time, next 3 to 5 years is golden time for any doctor to get into Australian healthcare system. After that, I think there are so many nurse practitioners coming, pharmacy practitioners coming. It's not it's not going to be pleasant. When they don't need doctors, they will not let you in. This is very serious. So make sure you work on it. And we have a free group, and the group you have to apply. You can't just come in there, because I had so many scammers coming in. So it's dr.talari.education@gmail.com. So it's Dr. TALARI.education education@gmail.com. All I need is a proof that you are a medical student or you're preparing for any clinical exam on planet Earth. I will let you into the group where you can get all these free resources and trainings. Seriously, there are some of them which people will pay. I run ads and people see these and they pay for it, and you can get it for free. And the reason why I do that is I really want to help you guys. I want to help you guys pass your exams, clinical exams, and be good clinicians. So there is so much free content. The reason I do that is I want you guys to trust that, yes, this guy knows what he is talking. This guy knows what he is teaching. He is a clinician with over 15 years experience. He is someone who is a RACGP, which is Royal Australian College of GPs Education Activity Representative, and a medical educator. And I'm a passionate guy. I created so many blueprints and guidelines and templates and everything, so I can help anyone who is struggling with the clinical exam. So I have a group coaching program. This will be like a weekly payment program where, you know, it'll be very cheap. I want as many people to be on the program as possible. So whoever you are, if you want to, you know, pass your clinical exams, and if you want to be a good clinician, then you will surely benefit, because what all I learned, I'm going to teach them. And in today's day and age, where there are so many scammers and people, you know, who use AI for everything. I use AI as well for a few things like creating some slides and templates. But I want to give you an opportunity to actually know that, yes, this guy is a genuine guy. You can actually check my Facebook page or YouTube videos and see, yes, you know, this guy is the right guy or not. But there are more things which actually people pay for, which means I put more effort and time into it. I want you guys to actually feel it. And if you believe that, yes, this guy can help us, then join the program. But nowhere you will be forced or nowhere you will be pushed to get into the program. It is purely a voluntary one, where 3 times a week we catch up. I teach you the strategy end to end on one day, and we'll do Q&A calls, like where if you have any doubts, you post it and I will answer them. Or if anyone posts, even in this free group, if I believe it's important, I will talk. There will be a separate group because I want to spend more time on people who are paying. But this group will be serious as well, like the free group. And there will be more guides, templates, and everything posted in the paid group. And we will do role plays where you will learn, you know, the real strategies which I'm using in my daily life as a clinician. And you will learn how to be fast, how to be successful, how to, you know, not miss a diagnosis and all those things. Again, it's an optional thing. Only if you want, you know, faster results, then that's optional. Otherwise, just send an email, dr.talari.education@gmail.com. I need proof that you are actually a medical student or a doctor anywhere in the planet. Okay, you are from Africa, doesn't matter. All I need is a proof that you are a doctor or a medical graduate, because I don't want scammers to be in this group and annoy everyone else. So I wish you all the best, and I will see you inside the group.